Assalamu alaikum everyone. This is Angel Imdad, your host for today. This session is in collaboration with SehatYab. From SehatYab, we have an amazing guest with us, Ms. Sukoon Fatima. Ms. Sukoon Fatima is a clinical psychologist from SehatYab. She is a CPCAB UK certified trainer, psychotherapist, NLP practitioner, and much more, with a specialization in food and addictions. So, welcome, Ms. Sukoon. Thank you so much for joining in today.
You're most welcome, Angel, and I must thank you for giving me this opportunity to be able to be here with this organization as co-green. And today I'm also representing the team of SehatYab. So I've recently joined this platform, and मैं चाहूँगी कि थोड़ा सा I would like to introduce you all to this platform. It's a very fast-growing, dynamic. Recently, I think we have a lot of spaces that have started, which are giving digital awareness in mental health. So we have, this is a platform which has a team of psychiatrists, psychologists, and a lot of other specialized work space here, which can provide psychological, emotional, behavioral support to all age groups. So yahan mothers, with children, work people, marital relationships, and it's not only for people in Pakistan, but it's extending to people all over the world, and they can globally access this platform for mental health. So today I am taking this opportunity to be able to represent SehatYab here along with the Go Green, to be able to share and speak about a very, very important subject of mental health and how interconnected our environment is with it.
Thank you so much, Mr. Poon, for giving us a very nice intro of SehatYab, and you all are doing a very great job. So, SehatYab का motto जो है, it's about spreading out the mental health awareness, right? So, because normally हम देखते हैं हमारी routine में we come from different backgrounds. Like you are a psychologist by profession, I'm an environmentalist, and हमारे यहाँ पे और multiple aspects होते हैं, multiple discipline के professions होते हैं. So, how much is it important? Mental health की importance in सब professional criteria में क्या है?
So I think that's a very dynamic. It's a very growing profession where you are kind of understanding the need of mental health in different spaces. So earlier on, mental health was one space जो अभी तक recognized ही नहीं था, open ही नहीं था to understand, because हम physically बीमार होते थे, we would go to the doctor, seek consult. But mental health, because उसके जो symptoms थे, उसकी जो the way it comes out is something which is more internal. हमें awareness ना होने की वजह से mental health had never been there in the different spaces of work कह लें, home कह लें. But now with this recent time, it is very, very important for us as common people to know that mental health is what I think it is primarily more important even than the physical health at one point, because a lot of our areas of physical health are connected with how well our mental health is. तो हमारे अगर हम घर में आप ले लें तो आपके interpersonal relationships, spouse relationship, parenting, all of that, अगर आप खुद mentally आप खुद बेहतर अच्छा नहीं फील कर रहे हैं तो आप खुद अपने घर वालों को भी वो क्वालिटी नहीं दे सकेंगे. एंड समटाइम्स आपको खुद पता भी नहीं होता. You sometimes are not even aware of what is happening to you in your inside yourself, and that's how you're unable to know how you are around with your people. यही चीज़ अगर हम वर्क स्पेस में देखते हैं, anger management, interpersonal हमारे colleagues में conflicts, because you're not well, you are not there mentally, you cannot focus, आपकी work functionality up to date नहीं होती, concentration नहीं हो रहा, deadlines meet नहीं हो रही. So in a workspace also a lot of times now, yes, coaching, organizational psychology focuses a lot on how you can manage your time better, how you can manage your conflicts better. Workspaces में interpersonal relationships आपके कैसे support हो सकते हैं, discipline, and all of these areas are now covering this broad space of mental health again. फिर हम अगर colleagues और अपने friend spaces में जाते हैं, interpersonal relationships में, again this area is very prominent because we may not know you're anxious, you're depressed, you're feeling low, आपको symptomatically you're not at your best, and so you're unable to perform well even in your other spaces of relationships. As mothers, because हमारा कभी कभार mothers are also working mothers, so they are taking a lot of stress from work, they're tired, they're exhausted, they are somehow facing their own challenges, they don't know where to talk to them, their concerns, and एक ऐसी space में जहाँ आपको कोई judge ना कर रहा हो, जहाँ आपको कोई एक professional space पे आपकी आपकी प्रॉब्लम्स को, आपकी कंसर्न्स को सुन के, समझ के, उनको एक क्लैरिटी प्रोवाइड कर रहा हो. So this is what actually a therapy is, which kind of helps you go a little more deeper down to know कि अगर आप इतना एंगर हो रहा है या आपके साथ कोई ऐसे मसाइल पेश आ रहे हैं as a mother, as in your marital relationships, या around at work, or maybe in the neighborhood, there are some people who are always on the edge. हर वक्त एक रिएक्टिविटी मोड में होते हैं, नहीं पता होता कि क्यों इस अंदाज में हम बिहेव कर रहे हैं. And this is where this entire area of mental health, either it be in conditions hai, or if not even in conditions, as normal, you and me in our own lives, in our own workspaces, we all need a support, we all need a space जो हमारे लिए safe हो, जो हमें एक कंफर्ट दे रहा हो, जो हमारे मसाइल को, वसाइल को, हमारी अपनी अंदर की दुनिया को बाहर की दुनिया से रिलेट करके हमें एक सेफ्टी प्रोवाइड कर रहा हो. So I think this is all what mental health is about in a gist, in an overview, and how important right now it is in all walks of life. And therefore, I think this understanding, this awareness of mental health can be very important to improve our own quality of life. हमारी अपनी day-to-day interpersonal relationships, हमारी work performance, हमारे अपने parenting styles, हमारे अपने interpersonal relationships at work with our colleagues. All of these can be supported and helped out only if there is this awareness and there is this support system where we are also aware of our own mental health. I think, Angel, I've been able to give you an overview.
Yeah. So, Mr. Kuhn, as you mentioned that at workplaces, mental health awareness is very much important, and I so believe that because in my previous workspace, I remember before doing my own work, so udhar I was in charge of the quality management system over there. So I used to arrange different kind of psychological sessions with the employees because I thought that it's very much important. So, considering that, Ms. Sakoon, that these days the inflation rate is so much unpredictable. Like every other day we are hearing कि अब इतना पेट्रोल चला गया है, अब इतनी महंगाई हो गई है. So in these circumstances, because employees की salaries तो are not increasing, so they have a very stressful environment that they are living in because उसके साथ साथ महंगाई भी उसी तरह से बढ़ रही है. So what you would suggest that how to cope up a bit with these issues that employees and every other person is facing in their daily life?
Right. Angel, I think this is a very relevant question. आजकल जिस time में हम in Pakistan or maybe globally, especially post-COVID, we've experienced a large scale problems in a lot of areas of life. post COVID or जो भी हमारे economic conditions that have come after, there have been great losses that we have taken. So we've lost our loved ones. After that, there is a lot of stress, there is a lot of trauma, and day-to-day stresses, like you mentioned, कि हम workplaces में भी the the market, the prices are so high. Common man has to feed his children. वो घर में बच्चों को देखना है, schooling, and all of these expenses can add to the pressures of the especially the breadwinner. अगर आप देखें कि हमारे मुल्क में भी the rate of depression is very very high in a lot of areas. जिसमें ये जो हमारी environmental conditions हैं, poverty is I think topmost, because if you're this is all which are kind of factors which are leading to your stress level. जब आप अपनी basic primary needs आपकी fulfill नहीं हो रही होंगी उस अंदाज से, और आप अपने अपने बच्चों का पेट नहीं पाल रहे होंगे, तो ये सारी चीज़ें हैं जो आपके स्ट्रेस को बिल्ड अप करती हैं. अब then there is this question कि how would these problems be solved by, and how is it connected to mental health? Again, this is directly impacting your thought processes. A lot of times आप अपने problems को इतना overwhelmed कर लेते हैं कि you keep thinking about it, and that is where the pattern of overthinking comes. हम कहते हैं ना कि stress किस तरह हमारा develop होता है. Stress usually builds up with the pattern of negative thinking, even if it's relevant thinking, practical thinking, but when there are situations which are not the best, like work opportunities up, so these are areas where you're on a losing end, where your conditions are not the best. You're thinking about it, and when you're thinking about it, आपकी दूसरी quality in your relations, in your parenting, maybe in your work also, you're not able to concentrate as well, because you're carrying so much of burden and stress that you're holding with the environmental conditions. इसके साथ साथ एक बहुत बड़ा element जो मैं साथ ही mental health के add करना चाहूँगी, वो हमारा environment भी है. And there have been researches which are directly connecting the environmental conditions with our stress levels. So अब हम बाहर निकलते हैं, there's like loud noise level, so much of honking, car accidents, traffic rush. इसमें आपका already stress level, घर में आप घर से निकलते हैं, बाहर आते हैं with this pollution, and nobody is trying to stop, nobody is patient on the roads, traffic rage जिसको हम कहते हैं. A lot of anger is coming out. You lose your calmness. फिर आप ऑफिस जाते हैं, वहाँ you end up into different kind of conflicts. You're unable to hear people. You are unable to be calm because you're already overwhelmed with your environmental conditions, जिन्होंने already आपके अपने problems में और problem add कर दी, and in a way the way they affect your brain, which is overwhelming. और जब आपका brain overwhelmed होगा, आपके thoughts they're going to be rushing in and whelmed. आपका खुद ब खुद focus कम होता जाएगा, आपकी concentration, आपकी जो ability to creatively think, seek solution, work and give quality at your given task, that will loosen. आपकी जब work performance कम होगी तो already you will be stressed कि अब हमारे साथ क्या मसला. And that is where the mental health comes in, where you need that space where you can talk about your personal problems, your areas. तो हम अमूमन generally बात नहीं कर पाते due to a lot of reasons. We can be judged. Sometimes हम किसी से बात करने जाते हैं, they might be coming with very good intentions and wanting to support us, but eventually they may give us some kind of an advice which is not working for us, which is not supporting or helping us, because you are not getting that holding, that clarity that maybe you need in that situation in the moment. And that is why there is this professional space of seeking personal therapy, counseling, could be work related, could be marital counseling, could be parenting, and therefore being aware of what is happening inside of you. अगर मुझे इतना गुस्सा आ रहा है छोटी छोटी बातों पे, तो मैं पहले I was able to manage them, I was able to deal with them in a better way. Then now, then I need to know what's happening inside of me. Sometimes we find कि हर वक्त मसले 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 बाहर हैं, but असल में ये चीज़ हो रही होती है कि हमारे अंदर ही कुछ ऐसा टर्बुलेंस होता है, कुछ ऐसी स्टॉर्म चल रही होती है जो हमें नहीं पता होता। वो हमारे एनवायरनमेंट की वजह से भी हो सकती है, वो हमारे अपने पास्ट, हमारी अपने लाइफ सिचुएशंस की वजह से भी हो सकती है। एंड दीज आर ऑल दोज डिफरेंट एरियाज जो जब हम एक सेफ स्पेस में एक कॉन्फिडेंशियलिटी के साथ एक एम्पैथेटिक लिसनिंग और ऐसी कॉन्फिडेंशियल सेटअप में बैठते हैं जहां हम अपनी मेंटल एरियाज और जहनी जो हमारी स्ट्रेसर्स हैं और जो प्रॉब्लम्स इस वक्त हमें फेस कर रहे हैं, जिनका कहीं ना कहीं अफेक्ट हमारी डिफरेंट एरियाज में आ रहा है। सो you're angry because of a certain problem, और वो सारा गुस्सा आपका घर में निकल रहा है because you still don't know where to talk and how to find solutions for yourself. So I think this is a very, very important area of your own personal health, for your own growth, for your betterment and giving quality to your own life. क्योंकि जितना आपकी जहन क्लटर्ड होगा, जितना आपका अंदर की इमोशनल स्टेट टर्बुलेंट होगी, ऑटोमेटिकली आपकी वर्क फंक्शनिंग, आपकी होम रिलेशनशिप्स, आपकी पेरेंटिंग, आपकी फंक्शनैलिटी, इंटरपर्सनल रिलेशंस विद योर फ्रेंड्स, विद योर कलीग्स, दे विल ऑल बी impacted and in a negative way. So I think I try to highlight the importance of how mental health, how seeking support, how being mindful and being aware of these areas of your own symptoms can help you better your own functionality at work, as Angel had asked. So, coming back to
That's
you,
great.
Angel.
The points that you highlighted, Mr. Kumbul, are definitely people don't think about this. So normally, अगर बात जैसे we come from our work is regarding environmental sustainability. So जब भी हम इसकी बात करते हैं, so लोगों का थोड़ा सा ये नजरिया आता है. Yesterday we had a talk and it was about कि रोटी कपड़ा मकान ही मिल जाए तो वही बहुत है. So, but we don't think about this कि हमारी environmental conditions, how much they have impact on our health, not only on our physical health, but of course on our mental health as well, as you mentioned. Because हम घर से बाहर निकलते हैं, रोड टूटे हुए हैं, पानी बह रहा है, नाले बह रहे हैं, एंड ग्रीनरी नहीं है. अगर चले ये सब चीजें भी हो ना, सो एटलीस्ट जो ग्रीन बेल्ट हमने डेवलप की होती हैं, सो वी जस्ट लुक एट इट एंड वी गेट रिफ्रेश्ड. जो हमारी स्ट्रेस होती है, whatever we are feeling, we feel a little better. So whenever I'm a little overwhelmed, yeah, I have a lot of the work going on or I'm stressed, I usually go to places which have more greenery. So I feel so good because I do that breathing exercises over there, and I feel really better.
Absolutely.
So
I will agree with you. Or yes, Angel. Yes, please continue. So मैं ये कह रही थी कि thank you for sharing your personal experience, because a lot of what you are saying is also what the theory and researchers are telling us. Abhi, just before, I was reading about, before this session, there was such a beautiful research that I want to share along. कि जो green color है, in itself has such soothing effect. And I decided to put on a green color and make that moment for you all to understand कि हमारा जो बाहर निकलते हैं, and they said कि green color has soothing and calming effect on your mind. It helps you focus better. It helps you to regulate your emotions better. And therefore, जहाँ जितनी greenery होगी, वहाँ mental health or mental conditions इतने inversely proportional होंगे. So I was just hearing you, and you were exactly on spot to point out how much this green. And right now, I must also credit this initiative जो Go Green का इस वक्त है बाहर. When we leave out, the children are pointing out banners, oh, Go Green. So, this is like such a beautiful initiative, so innovative, जहाँ हम अपनी energies को in a constructive way harness कर रहे हैं. हम अपने अपने बच्चों को, common man को एक ऑन साइट एक अवेयरनेस आ रही है कि देखिए आपको अगर कुछ बेहतरी लानी है तो हमें अपने लेवल पे काम करना होगा. एंड आई थिंक दिस इज द मिनिमल वी कैन डू to to just keep our environment clean, go clean, green, and by little efforts, like the way this organization has set up, I think it was very immensely inspiring for me to read and know how you people are working in setting up, establishing, and even spreading this awareness to the common man, where they can see, where they can hear, use the social media to be able to spread this awareness towards understanding how important it is for the country, for its beautifying, for the health of the people directly, the physical, and very importantly, जो हमारा इस वक्त subject है, the mental health also.
राइट. सो मिस सकून, बिल्कुल जैसे ग्रीन इनिशिएटिव्स की हम बात करते हैं, एंड आई ऑलवेज टॉक दैट एवरीथिंग इज कनेक्टेड. इट्स नॉट अबाउट सिर्फ एक सेक्टर है, सिर्फ उसका काम है एंड एवरीथिंग विल बी गुड. So it's not about that. We need to focus on every bit of the aspect of our life, I guess, and how the system works, the ecosystem works. So considering that, Miss Fatma, that एक बहुत बड़ा मसला है कि जैसे जैसे हम ये इन्वायरमेंटल डिग्रेडेशन हमारी हो रही है, ऑफ कोर्स क्लाइमेट चेंज के इम्पैक्ट्स हमारे ऊपर आ रहे हैं. सो रिसेंटली लास्ट ईयर इन 2020 देयर वाज फ्लड्स ऑल अराउंड पाकिस्तान, स्पेसिफिकली इन सिंध. सो देयर वर 33 मिलियन प्लस पीपल वर इम्पैक्टेड विद दैट. एंड मैं ये बात समझती हूँ कि इट्स लिटरली हम उसको वर्ड्स में बयान भी नहीं कर सकते. बट उस टाइम जो फिजिकल डिजास्टर हुआ वो तो हो गया, उधर की जगहें भी तामीर होना शुरू हो गई. पीपल आर गेटिंग देयर वर्क डन एज वेल एंड दे आर गेटिंग jobs again, and different setups, aids are coming in from international organizations. But are we talking about the mental state that they gone through? What happened there? Are they okay with it now? Are they recovered from that? So इस तरह का एक डिजास्टर हुआ, राइट? अभी हमारा रिसेंट, इस तरह के और बहुत सारे होते हैं. सो अर्थक्वेक्स हमारे पास लेट 2000s में बहुत ज्यादा आए हमारे पास, 2008, 2009. सो उस तरह से हम बात नहीं करते, बस हुआ, थोड़े से हमने काम किए, तामीरी काम स्टार्ट हुए, एंड दैट्स इट. So what would be your suggestion regarding this, and how, as me being a normal person, how I can play a role in it by doing something about it regarding mental health of them?
So this is a very, very critical, I think, a discussion that Angel has raised. And from the space of mental health, I would like to give my input here. कि देखिए जहाँ इन्होंने तबाही की बात की, it is a very, very natural disaster is one of the highest form of destructive trauma that any human being can experience. Because एक तो number one, it comes on a sudden wave, चाहे earthquake हो गया, floods हो गया, and एक तो it impacts a lot of your areas. एक आपके physical environment में एक लार्ज स्केल तबाही आ गई, जहाँ आपकी पूरी जो एक रहन सहन है वो ही ख़त्म हो गया. Either be it floods, earthquake, and क्योंकि 2022 we've like witnessed this on a very large scale, जहाँ बहुत levels पे हमारी destructive तबाही हुई है. But उसके साथ साथ जैसे मैंने कहा, people lost their homes, people lost their loved ones, and they lost everything, and they lost it in the spur of the moment, where they weren't prepared, where it came as a sudden tragic spur of a moment, and it shook it all. So यही और इसी को हम disaster, natural disaster कहते हैं, तबाही at a sudden disposal. इसके साथ साथ physically तो obviously a lot of people lost their lives, and that's irreparable. That is जो लोगों ने अपनों को लूज किया होता है, उसका जो गम, उसका दर्द और तकलीफ, जिसको हम ग्रीफ कहते हैं. So, in our language, within the psychological space, there is a term which is called grief, which is a very, very low state of emotion that we face after a loss. चाहे वो डेथ लॉस हो गया, कोई फाइनेंशियल बेयरिंग्स लॉस हो गई, रिलेशनशिप्स लॉस हो गए. और ग्रीफ एक ऐसा इमोशन है कि जो हम अमूमन उसको अगर हम सही अंदाज से ना एड्रेस करें तो इट कैन लीड टू लॉन्ग टर्म मेंटल कंडीशंस, इट कैन लीड टू अ लॉट ऑफ प्रॉब्लम्स विच समटाइम्स मे नॉट इवन इमर्ज एट दैट टाइम इमीडिएटली. तो जैसे उन्होंने कहा कि यू नो व्हाट आर वी सपोज टू डू. नंबर वन, अवेयरनेस. क्योंकि natural disasters in itself brings a lot of trauma of this big loss, shock, and that has impacted the minds of people who are still now living. Reconstruction to physical level पे हो गई, लेकिन what about your mental level? आपने जो एक खौफ, एक इतनी सडन स्पेस ऑफ तबाही एक्सपीरियंस की, एंड लॉट ऑफ पीपल, छोटे बच्चे हैं, mothers हैं, the husbands हैं, they've seen their own loved ones die in front of them, and that is big trauma. And then how do we support them? और वो चीज़, क्योंकि हम तो अपनी रिकन्स्ट्रक्शन में, रीबिल्डिंग में, इन्वायरमेंटल और फिजिकल एरिया को ही हमने टारगेट किया हुआ होता है कि हमने उसको बनाना है, उनको फैसिलिटेट करना है, उनको फिजिकल जो उनकी लॉसेस हैं उनको फुलफिल करना है ऑन अ गवर्नमेंट लेवल, ऑन अ सपोर्ट लेवल, कम्युनिटी लेवल. बट व्हाट अबाउट द मेंटल हेल्थ? एंड देयरफॉर it is very important to help all of those victims who have witnessed this trauma in the space of time to get proper mental health services by trauma therapies. And now a lot of work is being done. We've established teams, जो पूरी psychologist की teams हैं, which are basically trained in trauma training, जैसे EMDR, eye movement desensitization reprocessing. It's an intervention which is basically directed and aimed to treat trauma. And so with the flood victims, there have been specific teams from Pakistan, from different regions, who had gone there and taken group therapies, worked with different interventions, उनको therapies के थ्रू, उनकी बात सुन के, उनके दर्द तकलीफ को एक सिर्फ उनका सुन ही लेना, उनकी एक बात को समझ ही लेना, उनकी तकलीफ को एक्सेप्ट करना भी एक बहुत बड़ी उनके लिए रिलीफ है, उनके लिए healing है. So when we talk about all of those people who have suffered traumas by natural disasters, by any further losses, by death of their loved ones, or financial bearings, relationship, divorce, separations, children, young children die, these people are carrying the grief, और जिसके लिए हम specific grief therapies करते हैं. Stages of grief होता है, जिसको हम through therapies we identify कि अच्छा कौन सा stage of therapy में the patient is at, has he accepted the loss, what kind of a support they may need. And therefore अगर कोई उनके symptoms like anxieties, depressiveness, function, बच्चों में अगर हम देखते हैं कि a lot of work, like with my own experiences in practice, there were some children that were referred from school, और उनको बाकायदा कहा गया कि ये इनके एकेडमिक रिजल्ट्स अच्छे नहीं आ रहे, इनका अचानक से इनकी जो परफॉर्मेंस है टेस्ट में, दे वर लाइक ब्रिलियंट स्टूडेंट्स, हमेशा फुल मार्क्स आ रहे होते थे, कोई बिहेवियर इश्यूज नहीं आता था, बट सडनली दे आर नॉट परफॉर्मिंग एज वेल, दे कैन नॉट कॉन्सेंट्रेट, दे कैन नॉट थिंक वेल, दे कैन नॉट learn and remember and do their exams as well. So once they came in for this psychological support and they were in therapy with us, मैं अपने आप को personal cases के through share कर रही हूँ कि the deep rooted cause in one of the child was that he had witnessed a natural disaster. He was one of the victims of a flood, and after that, and it was years that this kind of a problem had come. तो ज़रूरी नहीं है कि मसला इमीडिएटली आ जाए और हम उसको एड्रेस भी कर ले. इमीडिएट होता है तो डेफिनेटली हम साइकेट्रिक सपोर्ट या साइकोलॉजिकल काउंसलिंग थेरेप्यूटिक अलायंस क्रिएट करते हैं, उनको हेल्प करते हैं, उनकी बात समझ के उनको जो नीडेड सपोर्ट होती है थ्रू इंटरवेंशंस उनको दी जाती है. But sometimes these problems could be deep rooted also. Like you could have witnessed something years back and it's coming also now. And because it had not been processed, it had never been addressed. So वो चीज़ें हमने अपनी suppress करके bury down कर ली. And after some times, it's coming out in different ways. या anxieties के form में आ सकती हैं, कभी anger हो सकता है, कभी mental conditions stem हो सकती है. So I think this is a very important area that we all must be aware of. Trauma by natural disasters, trauma by any other loss or grief that you see somebody has experienced within your own space, in family, at workplaces, or in far-fetched areas. जैसे हम इन शहरों की, छोटे शहरों की बात करते हैं, हम awareness mental health campaigns लगाते हैं, तो वहाँ भी हमें इन चीज़ों को बहुत importantly identify करना है. Or once we find out that they have been affected in some way or the other, we can provide relevant mental health support for them. Thank you, Angel. Up mute. Sorry, you're mute.
Yes, thank you, Ms. Sukoon. So I was saying that as you mentioned कि childhood से जो issues साथ चल रहे होते हैं और I have been part of different organizations in the past, so I have multiple experience with people. So usually जो हमारी northern side के बच्चे हैं, उनका बहुत different उनका towards उनका बातचीत का भी तरीका बहुत different होता है and confidence level is very much different. And बहुत दफ़ा ऐसा होता है कि towards certain things they act very differently. Of course, it's because what they have gone through. Maybe अच्छा इसमें मैं ये समझती हूँ कि बहुत छोटी छोटी बातें भी हो सकती है, like basic things, like for instance लड़की को पढ़ना है और उसको पढ़ने नहीं दिया जा रहा, so she is going through something, उसको नहीं शादी करनी, उसकी शादी कराई जा रही है, so वहाँ पे लड़के को बोला जा रहा है if he is feeling emotional तो बोला जा रहा है कि no, you can't cry, you are a boy and you need to take all the responsibilities because you are a boy, you are a man. So इस तरह के जेंडर उस पर बात आती है कि बचपन से क्या क्या चीजें फीड की जा रही हैं जो हमारे लिए, हमारे कल्चर के लिए बहुत नॉर्मल चीज है, बट वो हमारे इमोशनल साइड को कितना ज्यादा इम्पैक्ट करती हैं.
Absolutely, I agree with that.
So बहुत आपने बिल्कुल सही बात की कि बचपन से यहाँ पे मुझे ऐसा लगता है कि अब तो कुछ बड़े स्कूल्स ने इनिशिएटिव्स लिए भी हैं कि they are hiring some psychologists on board, so they can have conversations on weekly basis or monthly basis with the person, the psychologist. So लेकिन मेरे ख्याल से घर में भी जो है वो चीज़ को नॉर्मल करना चाहिए. जो हमारे थोड़े से पहले की जनरेशन है उनके लिए बात शायद थोड़ी सी समझने के लिए डिफिकल्ट है कि कुछ मेंटल इश्यूज भी होते हैं या फिर इमोशनल साइड से कोई सफर भी कर सकता है.
बिल्कुल ऐसा ही है. जैसे अभी आप बात कर रही है ना मेंटल हेल्थ की, सो आई वुड से पहले तो यही समझा जाता था कि कुछ भी ज़हनी तरीके से हमारा कोई प्रॉब्लम आए तो वो हम मेंटली ओके नहीं है, नॉर्मल नहीं है. लड़कियों को क्लिनिक्स लाने में ये होता था कि पता नहीं इनके लिए क्या कहा जाएगा कि ये ज़हनी तौर पे मरीज़ा हैं और इनका पागल हैं. इस तरह का एक मिथिकल हमारी एक पास्ट थिंकिंग थी टुवर्ड्स मेंटल हेल्थ, जिसको एक स्टिग्मा बनाया हुआ था. So with this time and awareness, I would like to also again, talk about mental health as something which is as important or as equal as a physical health. जैसे अगर हम बच्चा बीमार हो जाता है, खांसी, नज़ला, बुखार, आप जितना भी उसके लिए प्रिकॉशन कर लें, कभी ना कभी आप जितना भी प्रोटेक्टिव पेरेंटिंग कर लें, बच्चा गिरेगा, उसको भी चोट भी लगेगी, एक्सीडेंट्स भी होंगे और हम इमीडिएटली उसको हॉस्पिटल लेके जाएंगे, उसको केयर देंगे एंड दैट इज़ वेरी नॉर्मल. एंड वो अपना ट्रीट होके अगले दिन वो भूल भी जाएगा कि उसको कहाँ लगा था. बट जो
Exactly.
जिस जो और ये फिजिकल वुंडिंग है ना, ये दर्द तकलीफ फिजिकल है, बट जिस 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 सब्जेक्ट की आप बात कर रही हैं, दिस इज आई थिंक वेरी वेरी इंपॉर्टेंट, बिकॉज ये हमारी इमोशनल वुंडिंग है, जिसको हम एक टर्म देते हैं प्राइमरी वुंडिंग और इमोशनल वुंडिंग। और ये वुंडिंग वही होती है जो बचपन में बहुत अर्लियर ऑन हम बच्चों को बच्चों में वो वैल्यूज इंस्टिल कर देते हैं पेरेंट्स। वो कोई अनइंटेंशनली गलत इंटेंशन से भी नहीं कर रहे होते कि हम ये कर रहे होते, मे बी दे आर नॉट अवेयर, एंड दैट इज the reason why we are all here, to spread that awareness, because sometimes unknowingly, unintentionally, we might be giving our children those wounds जो उनको सारी जिंदगी अलग अलग phases of life में कहीं ना कहीं बाद में उभर रहे होते हैं। तो a lot of times in therapy we find कि अगर जो adults 20-25 साल के हैं और वो अपनी marital जिंदगी में settle नहीं हो पा रहे, तो उसकी वजह तो अमूमन उनकी husband और wife के problems नहीं होते superficially. It is
True.
it is most of the time stepping deep down in how that man or that girl was parented when she was young at that age, और जिनको हम एक टर्म देते हैं पैरेंटल इंजंक्शंस, कि वो पेरेंट वो ऐसी वैल्यूज डाल देते हैं जिसमें वो बच्चे की अपनी आवाज, अपनी चाहत, जैसे आप बात कर रही हैं स्कूलिंग की, द चॉइस ऑफ करियर, a lot of, you know, if you're coming from a business background, the child has to go and take up the father's business. अगर लड़की है तो उसने टीचर बनना है या उसने कोई लड़की वाली फील्ड लेनी है, so that you know it's something that the girls डॉक्टर बन जाए, ये बन जाए। बट हमें देखनी है कि हमारे बच्चे की अंदर की आवाज क्या है। Everybody is different. We are all born with unique personalities, with our own likes and dislikes and interests. एक ही घर में 4 बच्चे होंगे, उनके डिफरेंट माँ बाप भी एक हैं, एनवायरनमेंट भी एक है, पेरेंटिंग भी एक है, बट स्टिल देयर इज अ जेनेटिक मेकअप which is going to give them different likes and dislikes. So if somebody wants to take up art and they're interested और वो उसको voice out करते हैं, we should at least have that patience as parents to hear our children out, allow them to speak, ताकि वो हमसे बॉन्ड कर सकें। हमारे अगर एज पेरेंट्स हम वो ट्रस्ट उनको दें, उनकी आवाज़ को समझें, सुने, उनके साथ एक अच्छा रिलेशनशिप क्रिएट करें, तो ये जो बहुत से मसाइल हमें जो स्कूल्स में हो रहे हैं या लेटर ऑन एट डिफरेंट स्टेजेस एंड एजेस ऑफ लाइफ आते हैं, वही हमारे जड़ से ही क्रिएट ना हो। तो एट द एंड ऑफ द डे, अब कभी कभार बच्चा एक बहन भाई बहुत अच्छे मार्क्स लेके आ रहा है, जो सिबलिंग कंपैरिजन है, ये भी एक बहुत बड़ा डिलेमा है हमारे घरों में, जिस तरह तुम्हारी बहन ने कितने अच्छे मार्क्स ले लिए और तुम देखो नालायक हो और डम हो, एंड दीज आर वर्ड्स दैट एज पेरेंट्स और एज केयर गिवर्स हम अच्छे उनको सुधारने के लिए, उनको बेटर करने के लिए दे रहे होते हैं, बट अनकॉन्शियसली लाशऊरी तौर पे वही टर्म्स वो बच्चा अपने अंदर इंस्टिल कर रहा होता है, एंड समटाइम्स थिंग्स, अच्छा ठीक है, मैं तो आई थिंक since I'm told I'm like this, I may be like this. And he will lose his confidence to even try and move into different, explorations of life. बच्चों को क्यूरियोसिटी उनकी एक नीड है, एक्सप्लोर करना है, उनको उनके अपने इंटरेस्ट हैं. So as parents, we need to provide them that space at least where they can grow and they can be themselves, they can express what they are feeling. And if there is any certain problem, जैसे आपने कहा emotionally, अगर बच्चा disturbed है, bullying could be a big problem schools में, anything you cannot know sometimes. So that is where you need to also seek professional support. आपने कहा आजकल in the West, even in Pakistan now, every school now has to have a counselor, a psychologist, and the need and the idea is कि जहाँ बच्चे को कोई disturbance feel हो emotionally, उनके academics में, उनके behaviors में, and sometimes ये बात हम इतना notice नहीं करते अमूमन कि कभी कभार बच्चे का silent होना भी ज़्यादा प्रॉब्लमैटिक हो सकता है।
True.
हम समझते हैं बड़ा बच्चा तो इतना तमीज़दार, खामोश, एक हँसता-खेलता, एनर्जेटिक बच्चा है और वो एकदम से खामोश हो गया है। तो आपने उन as teachers, as parents, we need to also be aware and know for us what would be happening. Let us now give him that support and take support to be able to understand what may be underlying disturbance for that child.
बिल्कुल बिल्कुल मतलब I'm just seeing the comments as well that it's our responsibility to break generation cycles of abuse and neglect definitely. So वो बचपन से जो हैबिट्स डेवलप होती जाती हैं वो बहुत लॉन्ग टाइम जाती हैं एंड whatever is cultivated at our childhood it remains with us. I guess lifetime for a lifetime period. So same as that जैसे हमारी जैसे we were talking about the green habits and all. So इसको भी हम बड़ा कोशिश करते हैं that we inculcate this from the grassroots level at school level ताकि बच्चों को वो चीज़ है उनकी habit का हिस्सा बन जाए. They are mentally prepared that this is our responsibility. If we talk about the waste, that's their responsibility to take care of that. If we talk about plantation, that's their responsibility to plant a tree. So ये वाली चीजें जब हम उनको हम पूरी कोशिश करते हैं कि हम बचपन से और ये चीजें सिखाएं so that जब वो बड़े होंगे तो एक पूरा जनरेशन जो है वो शायद हम डिफरेंट बना सकें.
Absolutely. I think ये जो go green वाला concept है, as I'm saying, अभी तो सिर्फ हम थोड़ा बाहर banners और थोड़ी initiation देख रहे होते हैं. The children are, this is stimulation. जैसे हम कहते हैं sensory, आप experiential अपने level पे आप awareness create कर सकते हैं, आप उनको बता सकते हैं, समझा सकते हैं. But as you're saying, जिस तरह हम mental health की बात कर रहे हैं, उसी तरह बच्चों के अंदर to understand that their environment and that their country is also their own is a very big concept which we as parents, as professionals, as teachers, as caregivers all have to unite to give them and give them on a grassroots level. So I was just thinking about the way हम schools में बच्चों को nowadays, like a lot of schools are having community program welfare services which is adding to the credentials. ये सब चीजें अब वो awareness आई कि अच्छा अब हम बाहर universities apply करते हैं, so we need to work on specific community platforms, hospitals and orphanages पे जा जाके school level पे ये काम हो रहा है. So I think this is a great initiative which at school level, at home level, we can all take where the children can be given this responsibility कि जैसे हम fundraising करते हैं, bake sales करते हैं, हम बच्चों से in different art work करवाते हैं and all the money that is collected, we want to create that feeling of giving to them. तो हम उन्हीं का काम initiate करके sell करवाते हैं और वो खुद जाते हैं, वो देते हैं ताकि वो spirit of generosity उनमें create हो. Similarly, how about we create such programs where the children raise these with their own efforts, वो raise करें, and that amount they go and buy their plantations, they do the plantations themselves, and that is very therapeutic. By the way, Angel, at this point, I would like to tell you something कि with a lot of my client work, मैं एक जो इंटरवेंशन है बहुत ज़्यादा जो देती हूँ और कहती हूँ कि ये नॉन मेडिसिन, अगर आपने मेडिसिन नहीं लेनी और आपने चाहना है कि अपने डिप्रेसिवनेस, लोनेस और इन मूड्स को बेहतर करें, सो यू टेक अ ग्रीन वॉक. इट इज़ एब्सोल्युटली वेरी वेरी थेरेप्यूटिक. टेक अ ग्रीन वॉक, take a walk in a good oxygenated place which is clean, and ये environments हम अपने मुल्क में कैसे create करेंगे? हमें खुद ही वो एफर्ट डालना होगा where on our own simple level at least हम वहाँ जहाँ हम कचरा फेंक रहे हैं या बच्चे को देख रहे हैं, हम वहाँ उस लेवल से ही रोके ना उनको कि नो, जिस तरह हम घर की सफाई को अपना एक फरीजा समझते हैं, सफाई को निस्फ ईमान कहते हैं, तो how about making our environment and our country also an extension of our homes? तभी तो एक ओनरशिप आएगी, तभी तो एक वननेस आएगी और तभी हमारे बच्चों में भी इस मुल्क की मोहब्बत भी आएगी इस अंदाज में. And I see that we are having retreats. आपने सुना होगा a lot of retreats are happening. और हम कहते हैं कि हम मेंटल हेल्थ के लिए ग्रीन एरियाज में रिट्रीट्स करें, नारायण कागान, ये सब, एंड मे बी आउटसाइड कंट्रीज. So how about creating a green area in our own space where we don't have to move, anywhere outside, but in our own spaces, and just go outside our houses and find, green trees and plantations. So how beautiful and how I think insightful it will be for our children to learn and take that responsibility कि हम अगर कचरा कहीं देख भी रहे हैं तो हम उसको उठा लें, हम एक प्रॉपर उसको डिस्पोज करें, डस्टबिन का यूज करें, plastic bags, all of those, these things which cannot be recycled, उनको हम avoid करें. Cutting deforestation, और इन areas पे हम थोड़ा सा larger scales पे, and also on like these smaller scales where we can kind of rebuild our environment in a manner which is more healthy for our physical health. Oxygenation, आप देखें heart diseases, stress, cholesterol, sugar levels, a lot of our physical, आपने कहा ना जो interconnectedness है, so it goes on all levels. आपकी mental health impacts your physical health, the physical health and mental health is directly affected and impacted with your environmental conditions. तो आप बाहर निकलें, आप पोल्यूशन हो, इतना बार्जिंग नॉइज हो, गंदगी हो, स्मेल आ रही हो बुरी, तो उसमें तो आपका वैसे भी आप अच्छे खासे मूड से बाहर निकल रहे हैं और बाहर जाके यू फेस एंड गो इनटू एन डिलेमा. फिर आप ऐसे मूड में घर आते हैं तो वहाँ आपके इंटरपर्सनल, ऑब्वियसली यू आर नॉट फीलिंग योर बेस्ट. आप वर्क स्पेस में इस अंदाज में जाएंगे, you cannot function to your best, and simply, and you may not even know the reasons at that time, but
Right.
it is so strongly the environment and how it is impacting your mental health that is playing out on your function.
Perfectly said, Mr. Poon. So I was just thinking, as you mentioned, कि green spaces हमारे यहाँ पे definitely इतनी ज़्यादा नहीं है. But I was just, as you said that, I was thinking कि हमारे बहुत सारे areas में parks की space है. Yes, वो developed उतने नहीं है. स्पेसिफिकली कराची के अंदर इतनी ज़्यादा डेवलपमेंट नहीं है, या वो बंजर हो चुके हैं, यहाँ पे प्लांटेशन भी नहीं है. सो पेरेंट्स या पे यंग चिल्ड्रन एज वेल, दे कैन जस्ट स्टार्ट प्लांटिंग ट्रीज ओवर देयर. उनकी एक तो स्ट्रेस रिलीविंग एक्टिविटी भी हो गई, एंड दैट विल बी डेवलप्ड एज अ छोटा सा अर्बन फॉरेस्ट बन जाएगा कुछ टाइम में. एंड देन उसके बाद वहाँ पे जाना, उसमें बैठना, एंड द क्लीन एयर दैट दे विल ब्रीथ इन, सो दैट विल बी अ very big impact in their life and for the environment as well.
Absolutely, it's a great idea, I think. And Angel, I'm really inspiring to hear that we are actually working on these establishments. Smaller level पे हम कहते हैं ना, हम अपना एक कदम और एक little effort increases and big makes it larger. So I think and together we stand. So बात वही है कि the more united we are on different spaces and walks of life, हम as practitioners आ गए, आप लोग as management, children, so it is kind of parents with their own, people investing with their resources in their financing, the school spaces. So I think that it is all a teamwork that can establish these and make these ideas into a reality. और जो आपने अर्बन फॉरेस्टिंग की बात की है, तो इन द वेस्ट आप देखें, अ लॉट ऑफ स्कूल्स आर एक्चुअली डेवलप्ड ऑन अ स्पेस व्हिच इज ग्रीन. तो वो जो मॉन्टेसरी है उनका जो कंसंट्रेशन लेवल है, उनकी फंक्शनिंग है, बच्चों की जो हैबिट है और जो नर्चरिंग है. अब कहते हैं जो हम बेसिक लेवल बच्चों को अगर हमें एम्पैथी सिखानी है, वो कहाँ से आ सकती है? आप अपने अगर इन्वायरमेंट को नर्चर करें, पौधा लगाएं, उसको आप नर्चर करें, पानी दें, ग्रो करें, तो वो इन इटसेल्फ इतनी अच्छी एक ह्यूमननेस क्रिएट करती है हमारे बच्चों में एज एडल्ट्स ऑल्सो, एंड गिव्स अस समथिंग सूदिंग एंड प्लीजिंग टू look at also, and makes the city and country beautiful. We all admire beauty. So how about taking a start like this?
Beautifully said, Mr. Poon, because एक जो पौधा होता है, it's just like a child. अगर उसकी केयर ना की जाए तो it won't sustain. So अगर इसको डेवलप किया जाए and इस पे ध्यान दिया जाए that we need to nurture the plant उसी तरह से
Mhm.
अंदर कितनी आपकी वो एक एम्पैथेटिक साइड और आपकी इमोशनल साइड, कितनी ज्यादा आपके इमोशन स्ट्रांग होंगे बिकॉज ऑफ सिंपल प्रैक्टिस ऑफ प्लांटिंग अ ट्री एंड टेकिंग केयर ऑफ इट. वाओ, लाइक वेरी वेल सेड. Perfect. So, Miss Sukoon, we have one question. Although you have answered this in the start, but I would like to give a bit perspective again. So, Mr. Nadeem says that the chaos of traffic in Karachi causes a lot of road rage in ourselves, especially during the rush hours, and it destroys our day. How can we keep ourselves calm?
Okay. A lot of times जब हम ये problem को deal करते हैं, and it usually comes, this is not the first time I'm hearing a query like this. Road rage in itself is a topic that creates a lot of disturbance and anger in both men and women together. So, how I would like to address this is that there are certain variables which are really not in your control on the outside. But what really is in our own control is how we can react into our situations. हम जितना चाहें चीख चिल्ला के, परेशान होके, गुस्सा करके, फिर भी हम अपने आउटसाइड को नहीं कंट्रोल कर सकते उस अंदाज से जैसे हमारी अपनी एक्सपेक्टेशन है. अगर हम चाहें कि कभी भी रोड पे कोई ट्रैफिक जैम ना हो, कोई अल्लाह ना करे एक्सीडेंट ना हो जाए, कोई mishap ना हो, that is really not possible. And at my level, to think living in Karachi with the congestion, with the amount of traffic जो एक हमारा हो रहा है, वो बहुत मुश्किल है to really contain on. But how I would like to respond to it is, okay, there are certain things we can still control, and that is how about leaving a little earlier in time. अगर ज़्यादातर स्ट्रेस हमारा तब तब आता है, रोड रेज तब आता है जब हमारे अपॉइंटमेंट्स होते हैं, जब हमें कहीं टाइम पे पहुंचना है या बच्चों के स्कूल्स का टाइम है. एंड डेफिनेटली दैट मेक्स अस स्ट्रेसफुल इफ you have to reach on a very important interview and you are stuck in a traffic. It's very, very frustrating for anyone. But to be able to know and have a better reaction to it, we might want to now make it a point to leave maybe 10 minutes earlier in time. And we know that if this is a certain road that I take every day and it is or it can have these problems, let me attain my calmness at least if a situation like this falls, which is still not in my control. Secondly, a lot of times I feel that simply pausing can also help you save a lot of reactions. हम अमूमन देखते हैं कि रोड्स पे जो कॉन्फ्लिक्ट्स एकदम से लड़ाइयाँ शुरू हो जाती हैं, ये भी बहुत कॉमन है हमारे यहाँ, हमारे मुल्क में. मैं विटनेस करते हैं हम कि छोटी किसी की भी गलती हो एंड 10 लोग बाहर निकल के लड़ाई झगड़े हो रहे हैं. सो एट दैट टाइम मे बी जस्ट अ लिटिल पॉज कैन सेव अ लॉट ऑफ टाइम फॉर योर ओन सेल्फ एंड फॉर अदर्स ऑल्सो, बिकॉज आपकी एक रिएक्टिविटी और सिचुएशन को इनलार्ज कर देती है, और पीछे वाले लोग भी दे आर अगेन वेटिंग फॉर योर कॉन्फ्लिक्ट टू एंड सो दे कैन पास एंड देन इट फर्दर एड्स टू द ट्रैफिक. तो अगर आप कहीं वो जो कहते हैं ना, a little letting go, a little patience, a little calmness in your own self can save bigger hazards that are to come. And the third important aspect जो anger और rage का है, वो आपका खुद का अपना एक deep rooted area भी हो सकता है. Necessarily आप इतना गुस्सा जरूरी नहीं है कि आप एक road situation पे ही आपको आ रहा हो. There could be other variables, other situations in your life which you are not addressing, maybe not accepting, maybe, or not seeking the right support, and they are coming out in different forms and manifesting. अब जिस चीज़ पर आपका कंट्रोल ही नहीं है, आप सिग्नल खराब हो गया या रोड सिस्टम, दिस इज वेरी कॉमन. सुबह स्कूल के टाइम में पे हर थर्ड रोड पे आपको एक ट्रैफिक का एक मैस होगा. बट देन व्हाई आर वी रिएक्टिंग एंड सो ओवर रिएक्टिंग? दैट्स द क्वेश्चन वी नीड टू ask ourselves also. How can we attain and maintain our ease and stay still calm in a situation which is overwhelming, which can be overwhelming, and yet requires our own patience and sustainability in it? I think that's what I can offer here.
Mr. Kuhn, that's very practical example actually. So I would like to express my opinion in this. What you said regarding the road rage thing. So whenever I'm having a bad day or I'm agitated over something, and then when I'm driving, I feel that बहुत ज़्यादा ही ट्रैफिक है, हर चीज़ पे गुस्सा आ रहा होता है, हर दूसरे बंदे पे गुस्सा आ रहा होता है. So that's really बिल्कुल सही बात है. It's not only about the outside condition, it's within ourselves as well. And apart from that, जब मैं लेट हो रही होती हूँ तब ज़्यादा ट्रैफिक लग रहा होता है. So when I have time and I take out, I'm early on the road, so तब नहीं लग रहा होता, मतलब तब सबसे बहुत होता है comparatively. And even if I face the traffic, so I know that still I'm gonna make it on time. But yes, we need to have we need to change ourselves first to have a positive impact on the whole situation. Perfectly said, Mr. So, Mr. Kuhn, as हमने काफी सारी बातें की and it was very insightful. So, I would like to know that what are, because हम हर अपने guest से पूछते हैं कि ऐसी कौन सी green habits हैं, sustainable habits हैं that they have adapted in their life or they want to adapt, they haven't still adapted, but they're looking forward कि हम ये कर सकते हैं अपनी life में, which will have a sustainable impact on our environmental conditions.
Okay, so this is more specific to the environment, right? So you're talking about those habits which could be, all right, great. So on a very personal level, I would like to again give ये वाली चीजें मैंने differently at different times offer किया है, in the different questions that had come up, but just again to talk about having healthy habits, which will be as simple as if you're going out, you're not littering and throwing litter outside. You're using the waste baskets. You are making your own effort first in your home, around your own space, to be able to support cleanliness. और cleanliness support number one इसी अंदाज से हो सकती है जहाँ हमारी waste reduction हो. As simple as being very consciously mindful about littering and using the waste. दूसरा, the plastic, and this एक बड़ा अच्छा revolution आया था where paper bags were being replaced and biodegradable, and we still have eco-friendly materials that we can use. So creating and spreading that awareness on smaller levels, on shop levels, public levels, and the target, I think, are the young children. So habits as young, if they are given, they can be most sustained, they can be long term, and they will be more deep rooted. Just say Angel had suggested about the children planting their own trees and extending further with plantation. हम अपने छोटे सिंपल गार्डन अपने घर के एक एलीज में छोटे प्लांट्स क्रिएट करें, घर में बच्चों को प्लांटेशन की दिखाएं, nurturing. It's very nurturing, it's very therapeutic. So to start at home by having small indoor plantations, outdoor plantations, having the children take care and nurture them by giving them water on time, and therefore extending them outside on their levels of planting outside in their neighborhood, extending to school level, having small areas where they can plant and label their trees and have that tree grow in the long years that may come. So that could be one. And एक और चीज, अभी हम road rage की जब बात कर रहे थे, तो I think I could add this particular point here as a habit, because a lot of times on road rage हम खुद भी उसमें एक contributor हो सकते हैं. And I personally experienced that in my day-to-day running as well. So that when we are late, we are already stressed, we are already overwhelmed, we are already हमारी thinking वैसे भी overwhelmed है, we are fearful, we have to be on time, we have a test, we have an appointment to reach on. So when we go out in the stress, sometimes we are also creating that traffic, that congestion. We're telling the driver to drive fast, the honking, and that is creating problems for ourselves also and for other drivers also. तो हम खुद भी ड्राइवर्स को कहीं ना कभी कभार के जल्दी चलाएं, हॉर्न दें, इधर इधर देखें, उधर देखें, यहाँ कट ले लें. So how about being that one first who can make small positive changes, and our children are the observers. So the way we are behaving, the way we are interacting, we are in our environments is largely impacting how our children are receiving us as well. So it's kind of going together. Small changes and bigger betterments.
Because I would agree, Ms. Sukoon, with you, and great initiatives that you talked about. And lastly, I would like to ask you that one last opinion that you would like to give to our audience listening right now, and बाद में भी जो देखेंगे, it can be regarding mental health awareness or anything that you want to put your word across.
Okay, so it's just one line, and it can be.
No, you can talk. You can talk.
It's going to be one line. It is one line. This is going to be summating everything that we have spoken so far in different sections. And if we can just take this one line with us and then reflect on all of those different questions, then feedbacks, inputs, your sharing, my sharing out here, it can create a big difference. And so that one line would be go green, go clean, find mental ease and sustain your peace. ये चार चीजें हैं. And I think clean, green, mental ease, and at the end of the day, it all will come up to your peace.
Amazing. बहुत आपने लिटरली आपने बहुत सारी चीजों को एक लाइन में आपने कूजे में बंद कर दिया, and that's perfect. As I was mentioning कि everything is connected, so perfectly said कि छोटी छोटी ये चीजें करेंगे तो खुद ही ईज मिल जाएगा. Perfect. So I hope you enjoyed today's session, Ms. Sukoon, and.
It was a great opportunity to be able to serve such two important, organizations together, Go Green and then the mental health, and how they're interconnected on a platform together. I think that's a great. Thank you for offering this opportunity where I was able to share a little bit of my knowledge, and I hope it could have benefited people at different levels.
No, I myself has learned a lot, और बहुत सारी ऐसी चीजें थी again जो हम normally नहीं सोच रहे होते, but it's very much important the things that you mentioned about how we can keep ourselves calm and regardless of the environmental aspects and impacts that there are around. And बहुत सारी चीजें जो की वो that was very insightful for me as well, and definitely that would be for our viewers too. So Mr. Nadeem, I hope you got your answer, which was briefly described by Ms. Sukoon, and Ms. Umra also appreciates different kind of things that we talked about regarding the family abuses and things that we get from our family, generational cycles, and she also mentioned that it's very, she said that it's very amazing that we should expose our children to nature because it introduces them to different textures and colors too. It's very well said. So with that note, I would like to end the session of today's. And it was great. सिर्फ हम एक चीज की बात नहीं करते, it's about बहुत सारी चीजें मिलके हम सस्टेनेबिलिटी की तरफ जा सकते हैं. And Evede's tagline is Alliances for Sustainability. So we believe that we can't reach our goals until and unless we have different people along with us. So thank you so much for joining in today and being so insightful and so thoughtful about all of the topics that we discussed today. And I hope that we can have you again sometime and discuss some other topics as well.
Thank you very much. It was really a great experience for me as well. And inshallah, we'll keep in touch and talk more at different levels.
Inshallah. So thank you so much, viewers. Have a great weekend. Khuda Hafiz.